Hey friends, today we had a 30-year-old female patient who's a known case of asthma who presented with the chief complaints of generalized weakness and swelling in both legs for the past 3 weeks. She had what we call as moon facies, and a little bit of hirsutism was also very much evident. There's a small buffalo hump on her upper back and the abdomen is full of striae, which she said she had since she got pregnant a couple of years ago. The main DDs are obesity, Cushing syndrome, and hypothyroidism.
So in this case, we have to understand how to differentiate Cushing syndrome from obesity and from hypothyroidism. Let's look at the chart of signs and symptoms given in the chapter of Cushing's disease. So the patient has increased body fat. The patient can have central obesity, rounded face, but these things are there in any obese patient. The point which helps us differentiate the obesity of Cushing syndrome from other causes of obesity is that the extremities of the patients are relatively spared. The stria that we get in patients of Cushing syndrome are more purple, wide, and they can extend above the umbilicus. Osteopenia and osteoporosis can be found out only after we do a BMD test, so these things cannot be appreciated in the OPD. All obese patients may complain of generalized weakness, but in patients of Cushing's disease or Cushing syndrome, we can find a disproportionate proximal weakness. Hypertension and edema are non-specific and they can be present in other causes of obesity as well. Obese patients can develop insulin resistance because of the obesity, and then they can develop diabetes as well. So this point doesn't help us distinguish Cushing syndrome from obesity. Now this point is important. Because of prolonged increase in steroid levels, the pituitary gland may get suppressed, and because of suppression of the level of gonadotropins, the patient may develop amenorrhea. The CNS complications and increased susceptibility to infections are again non-specific. So the findings that make the diagnosis of Cushing syndrome more likely are obesity with relatively thin extremities, purple stria more than 1 centimeter in width, and amenorrhea. These are the signs and symptoms given for hypothyroidism. Now, most of the points are very non-specific. Tiredness and weakness are there in every obese person, and dry skin is something that we associate with hypothyroidism. But even then, any patient who is obese can have dry skin. Cold sensitivity is a strong point in favor of hypothyroidism. In addition, patients of hypothyroidism can have bradycardia and they can have delayed tendon reflex relaxation as well. Let's summarize the findings that suggest hypothyroidism. They are cold sensitivity, hoarse voice, hearing loss, menorrhagia, dry coarse skin, bradycardia, delayed relaxation of deep tendon reflexes.
Let's come back to our patient. This was her arm, which is definitely not thin. Talking about the striae of Cushing's are supposed to be more purple, wider, and they extend above the umbilicus. This patient had regular periods. She did not have any cold sensitivity or bradycardia. So the most likely diagnosis in this case is obesity. Thanks for being with us. We'll see you in the next video.